really is to serve children and families where they are on their continuum of economic prosperity, economic mobility. And so some of the things that we do is provide these blended and braided services so that as families are achieving economic mobility, they don't need to leave. We can ensure continuity of care on that continuum by allowing them to go from a Head Start slot to a pre-K count slot. But there is the cliff effect, for infants and toddlers and some pre-K when we think about the drop off of subsidies. And so when you hear Rebecca talk about EITC scholarships, it's one way for pre-K that we can try to close that gap for the families that are just over income. And so that is one of just a high level summary of what we're trying to provide the community through our services at CAP.
One thing I think about is that in order for this community to thrive, we're going to need everyone. We're going to need everyone's best thinking and best skills and best opportunity to work and grow and learn. And we can't do that if women are not fully engaged. And women can't be fully engaged if they don't have childcare. Now, of course, there are men responsible for their children. There are all kinds of family dynamics and shapes of families. And predominantly, women are responsible for childcare activities.
Mike, I want to bring you in. I know that you love policy. I've known you long enough to know how much you love policy. So there is a allocation for $60 million for pre-K counts, which was just referenced, and $19 million more for Head Start supplement assistance. Can you just, what does that mean? I mean, the government's role oftentimes is sort of slamming in a lot of money, sometimes with more or less guidance, but what's going on in that space? What's the thinking, and particularly if there's anything that you can highlight that is bipartisan in that, like we always love that, right?
Yeah, well, there's a couple things that it's focused on. One is increasing the number of slots available. So we're trying to make sure that the number of subsidized slots that are available for families increases so that there's not waiting lists and things like that. We know that even though we put more money in, there's still waiting lists. Another part was to try and increase the wages for daycare workers or for the people working in these facilities. That's a little tougher one because you're basically sending it to the facility and saying, pay your workers more. And we don't know how much we're in the process of trying to write the regs in such a way that, I trust if I send money to the Y and say, pay your workers more, they're going to pay their workers more. That may not be the case for every daycare facility that says, hey, my workers are willing to work for the price they were before. So I'm just going to, pocket the money and now I make a little more profit than I used to. And we don't think that that's going to be the case because in almost every case, they're going to have to pay workers more if they want to keep them. We know that there's such a dearth of daycare workers that everybody is going to have to increase their salaries.
Education and awareness to all sorts of folks about childcare. It's not just about the location. There's the workforce. The workforce has had a very difficult time since COVID, and even before COVID started. The workforce compensation, or the compensation of the workforce, is not where it should be. On average, a childcare worker in Pennsylvania makes $10.69 an hour, and that's based on 2019 data. So that's something that we've been trying to educate those policymakers, legislators, and there were some funds in the state budget this year to help with it. It's not everything that we had wanted. And, the childcare workforce needs a lot. It's competing with other sectors. As Representative Sterler mentioned, they just can't compete and recruit and maintain or retain the staff that we do have.